So my name is Himanshu Saxena, and I'm the co-founder and CEO at Moss AI. Again, I am not the first engineer who is coming here and saying that I'm an engineer, but that's the flavor of the day. So let me just, take you through these slides because I'm sitting in front of medical fraternity. I want to ask you if you can recognize any of these instruments. Anyone? Yeah, that's the first microscope in the world that was produced by Anton von Leeuwenhoek in early 1600s. And he was a textile worker. He liked to explore cotton threads and so on. And the second one is the world's first stethoscope. It was just a piece of paper rolled and put, and he could listen to the patient's heartbeat using that stethoscope. And the third one is, of course, John Snow, where he charted out cholera patterns in London. So that's how he came across a particular hand pump that had rat died and spread of cholera. So what I'm trying to tell you here is that to create medical devices, it's not necessary to be a physician. I'm an engineer, and I have been doing a lot of product building from 2019 onwards. It was earlier in 2023 that we launched Moss AI as a mobile app. It was a record and transcribe app. And later in the year, we tried to pivot it to healthcare, where we understood the life cycle of disease treatment and how it can fill in that gap. So kind of 2024, when we hit the agentic kind of systems, where now we are trying to integrate with EMR and HMIS providers in India and the world. We have significant traction closing last financial year as well. But you might think, okay, now it's done. We have a couple of features, couple of customers. What can we do more? So what we have also observed is that patient data is of 5 primary types. It could be biological data, it could be clinical data, it could be genomics, it could be imaging, and it could be pathology. So out of these 5, we primarily focus on the clinical data, that is the clinical, everything happening inside the physician's room. And what we want to do is we want to focus on the documentation of it. So any kind of unstructured patient data could be structured and filled into the EMR that is present with you. So this is the vision that we have. I don't know why it's bits and zeros, maybe because of AI, but our vision is to have a collective clinical intelligence where we are starting with integration of AI into different EMR providers and also HMIS providers. This is how we look at the problem. At a healthcare facility, we can just have a cross section of it, wherein within a physician's room there could be report entry, there could be patient data, there could be summarization of reports, there could be medical coding, a lot of use cases that are available on my platform as features. And how we do it is with trust, transparency, and first principles. We have built this technology agnostic of the technology. So the processing is done on GPUs. But even if India takes the quantum leap and we are to serve our customers in 5 years of time, we'll be able to provide that. And then everything is cloud-based. That is also one of our first principles. Currently we are working very closely with healthcare providers and organizations. We are also working very closely with healthcare tech players, that is the EMR providers and HMIS providers. Additionally, we want to do certain transformative and incremental changes in life sciences and pharma. So this is some of the existing healthcare landscape. How we differentiate from others is that we are very physician-centric. We understand what a physician requires in the room, and we want to focus on his needs. Lastly, why I am also interested working with Rich and Yashoda hospitals is that I understand they are very early adopters of technology, and they have a kind of strong track record in creating strategic partnerships and innovation systems. So, and we also see that has a deep alignment with our vision. So again, thank you, Dr. Sushmita and Arvind, for giving us this opportunity and this stage. And that's my time.